being called a quademic by some.
Sabrina Wilson has more on the different viruses circulating and how they're impacting both children and adults in Louisiana.
This is the CDC's flu map. Louisiana is colored purple for very high levels of influenza or the flu. This is another CDC map on respiratory virus activity levels by state, and Louisiana has a designation of high. I turn to two respected medical professionals. Dr. Fred Lopez is an infectious diseases specialist at LSU Health New Orleans. And it seems to be raging.
It is, and we've been raging for several weeks now at very high levels. In fact, more than 80% of the country has high to very high levels of flu-like illness being reported.
Dr. Mark Klein is the chief medical officer and physician-in-chief at Children's Hospital New Orleans.
Being hit pretty heavily right now. There is a fair amount of RSV out there. It sort of peaked towards the end of November, early December, and it has come down a bit, but we're still seeing quite a few cases of RSV and a lot of influenza right now. Influenza has really hit us hard.
In addition to the flu, COVID hasn't disappeared, but vaccination rates are waning.
In a given year, less than 50% of adults are going to get the flu vaccine, which is a universally recommended vaccine for individuals 6 months of age or older. Right now, a little over 20% of adults who are eligible for the updated COVID-19 vaccine have received that updated COVID-19 vaccine, which is also recommended for everyone 6 months of age and older. And so, and there is an RSV vaccine for individuals who are older.
And also circulating is the norovirus. But Dr. Lopez says that is not a respiratory condition.
That's a gastrointestinal illness,
which can make you really sick.
It produces intense vomiting and diarrhea, and the key to avoiding norovirus is meticulous hand washing. And hand sanitizers don't work very well against norovirus.
Some call it a quademic because of the flu, COVID, RSV, and the norovirus.
Well, we're busy, and but you know, respiratory viruses are really a driver of hospital admissions and emergency department visits and visits to primary care physicians, and that's what we're seeing right now.
I think it always is putting pressure on healthcare. We're seeing increasing numbers in the emergency departments. Some patients are actually getting admitted to the hospital.
But they're not being stretched like during the height of COVID-19.
That was Sabrina Wilson reporting. Dr. Klein says there are kids who weren't exposed much to the flu during the peak of COVID due to masking and social distancing, and they may not have the immunity against the virus that they might expect. Dr. Lopez says influenza A is the most common flu strain right now, but even if you've had the flu, get vaccinated because influenza B may emerge, and the vaccine covers that.